I'd like to take this opportunity and introduce our first speaker, and that is Clarence Small. Clarence Small is a native of Kansas City, Kansas, and he earned a bachelor's degree in social work and a master's degree in education. He's an Academy certified social worker and a trained family mediator. Honestly, I could continue to read his bio. He is of esteemed pleasure. We are very pleasured to have him today. Clarence is very knowledgeable, but most importantly, in my opinion, he is a wonderful person. And I think that as he speaks to you today, you will certainly get a window, if you don't already, into his personality. So with that, I do want to turn it over to Clarence Small and welcome him to our event today. Clarence.
Well, thank you, Stacy, for that introduction. Want to just pause to say thank you to the Missouri Head Start Association, to the Collab office, to the TNTA system, and our state partners for the things that you've done to make this come alive. This is my second time participating in one of these historic convocations, and it's really a privilege and an honor to stand before you all as the regional program manager. I take that role very serious, and I'm very serious when I say that of the 12 regional offices located across nationally, I am just honored to stand anywhere I can on behalf of Region 7. Because I think that here in our region, which represents Missouri, Iowa, Nebraska, and Kansas, we do things right. We are always on the cutting edge, and this meeting is just one of the events that makes us so good at what we do in regards to the lives of the children and families that we represent. Had the privilege of being in Iowa last week as they were doing a school readiness summit. And again, I just echo that it's just awesome to be a part of this process. I'm going to move fairly quickly through many of my slides because also I'm privileged to have a couple of members of our office here. Mary Weathers, who's a program specialist, wave your hand, who's going to definitely you'll hear from later on this afternoon. But I'm also, we were able to bring along with us Betty Lamley, who is the regional program manager in our office for childcare. So I want to make sure that I yield and so that she has some time to talk a little bit about and give you a little taste of what's happening on the national scene. We both Betty and I were at a historic event 2 weeks ago, I believe, where the National Director for Head Start, as well as the National Director for Child Care, we're all in the same room. All the regional program managers from both Child Care and Head Start were in the same room. And we just kind of forged out and really had a discussion about collaboration and about partnership within our own offices. And so I want to make sure that she has some time to give you just a little taste of what was discussed there. Again, as my role is the RPM, high quality early learning is very, very important to the Office of Head Start. Every meeting, everything that is done, is the emphasis is on high quality. And as a result of that, this the title that was put together for this event is very important, supporting health and safety. I'll go through my slides, but I will just share with you as we look at the regulatory pieces of that, health and safety has taken on a whole new light because of the importance, and hopefully I'll share that with you. I was given the task to really kind of, we're going to do almost a history lesson. I was asked to come and just to talk about the regulations as they relate to Head Start. And as I'm talking, it will just kind of infuse some of my own thoughts into that as I know them to be. So for the Head Start folk that are in the room, this is not going to be any earth-shattering new information, because many of you all have been in the business for many, many years. And most importantly, you are intimately involved in the regulations. Many of you all probably know the regulations backwards and forwards and to the sides, and sleep with the book at night and wake up in the morning. And so again, this won't be, but for our child care colleagues that are in the room, state folk, perhaps and hopefully some of this information will be new to you and hopefully important and interesting for you to know. All right. Starting off with just a little of the history. I think most of you all in the room, if you don't know, that it was in 1964 during the Johnson administration that things got started in regards to Head Start. It was 1965 when the first creation of Head Start as a 8-week program. I was in Washington, D.C. not too long ago and had the privilege of sharing. They had what they call Founders Day in the Office of Head Start. And many of the initial folk, now retired, who helped fashion and hew out what Head Start was going to look like, was in that room. And it was very interesting. And at the same time, I was very just privileged to be there to listen to the passion of these folk as they talked about being in the room. And I believe the first Head Start program was in Mississippi, and they talked about some of the things they had to encounter because they basically came in a room and they basically didn't know what they wanted. They knew what they wanted to do, but not sure how to carry it out. But with all the meetings of the minds and the passion that was there, created what we now know of as Head Start. And for since 1965, over 30 million children have been served. And that's a milestone within itself. Over 30 million children that have gone through Head Start program. One of the things that I think is important is that last bullet. It's important to know that Head Start is one of the most federally regulated programs that the federal government operates or oversees. And I see some folk nodding. Everybody in Head Start, do you believe that? You know, I don't know. I don't know if this is factual or not, but based on what I've seen, I would say that it is, you know, they always said that the Department of Defense has the most regulations. And I would wonder if we're not a close second to that. If you know, again, I don't have any statistics or anything to factually back that up. But we do know that there are regulations for just about everything that Head Start does. And it's because of those regulations, a lot of times, if you're not entrenched or involved in Head Start, it sometimes creates a misconception of what Head Start is all about, especially as our programs are that are out there in the communities doing the day-to-day work, as they're out there trying to partner and trying to collaborate with other community components, especially childcare. And I'm going to talk a little bit about that as I close out, about some of the hot topics that are still out there that I think are important for us to carry on this conversation with. Told you I was technically challenged here. Try to make sure. When you look at the regulations, you can kind of narrow them down into the 5 that you see up here on the slide. It's the Head Start Act, the performance standards, the program instructions, the information memorandums, and the policy clarification. And I'm gonna again kind of walk through each one of those to kind of give you a little taste of that process. First of all, you look at the Head Start Act. Head Start Act of 2007, and that's our most current that we have up. Again, I know this is small type, and I don't know if you're going to be putting out, Tina, you're going to be putting out some of these slides for you to have. Oh, I see heads nodding in the back. Okay, so you all will get these slides because there's nothing secret on here, nothing earth-shattering. But again, it'll let you, if you look at this, you look at the different sections and you look at some of the titles in here, the statement of purpose, definition, Head Start transition, Head Start collaboration. Everything that Head Start is about is mentioned in these in the Act. There are 29 sections with regulatory language that defines requirements that every Head Start program must meet. And I think the key word in that is must. It's not optional. They must meet these criteria. And we'll talk a little bit about what happens if they should not. And then there's the Head Start performance. From the 45 Code of Federal Regulations, from 1301 to 1310. This is almost serves as the Bible for Head Start. Again, if I was to ask in the room, how many Head Start programs we have here? Head Start. This is the Bible, right? Before, from a regulatory body, even from our regional office, if someone calls us about a concern or a question, before we're not going to give our opinion for the most part. What we're going to do is we're going to go and look that up, or at least try to look that up, to try to find what does the regulation say about the question that's being asked. And again, these folk that you saw raise their hand, this is the Bible. This is what they use on a regular routine basis, because again, this is what they're going to be monitored on. This is what's going to be important when that group comes in every 3 years to look to see if they are following federal regulation. This is what they have to look at when members from my staff come out to do a routine staff site visit. These are the things that we hold our Head Start programs accountable for. And again, they're not optional. They're mandatory. Then we have program information, or program instructions. Program instructions are released periodically by the Office of Head Start to provide explanation and clarification on a given topic that Head Start programs are required to implement. I put down some examples of that. The standards talks about under-enrollment, but just so that we can add a little bit more clarity to that, program instructions will go out periodically that talk about under-enrollment. In some cases, to talk and to ensure that Head Start programs understand that under-enrollment is important, and that every program should be striving for to be fully enrolled. And if not fully enrolled, then there's guidance given in regards to what will happen and what should happen. One of the big things is keeping the regional office informed of why that program is under-enrolled. What are the dynamics going on in that community? Because we monitor that on a regular, constant basis. Funding guidance, as funding guidance come out, and from time to time, even as we speak today, we're under a continuing resolution. The budget has not been passed, but we must keep operations going. So there's program instructions that come out to let our grantees know, don't panic. The money will be there when it needs to be there, even if we have to prorate that and pay and put out only, in some cases, 45%. We put that out so that we can let grantees know that, it's going to be okay. And as soon as the rest of the funding comes, you will get that. So again, program instructions are simply there to just provide guidance and more, and to give more information. Criminal record check, I put that down there because again, interesting enough, we put a program instruction out, but that seems to be one that still continues to trip folk up. And I would just say that criminal record check is not an option. And for those who are here for childcare, I will say that this is probably one of those huge hot topic areas, because the Head Start regulation, the Head Start Act says that that Head Start programs must have that criminal record check or criminal background check prior to hire. Cannot hire that person and then wait on it coming. And I know there are a lot of reasons out there in regards to, the backlog in the state, or the backlog in, with the Bureau of Investigation, State Bureau, all those. I know we understand and recognize that these things happen, but the rule is clear that you cannot do that prior. You cannot hire someone prior to that not being done. You have to have that criminal background check. And that has tripped up a lot of folk nationally, not just regionally, but nationally. And we recognize that that's an important piece because, again, when you start talking about collaboration and you start talking about partnerships, that hinders that from happening in some respect. Then there are information memorandums. Information memorandums are simply documents that come out periodically to inform and to announce the Head Start community of a new initiative or emphasize a new requirement that Head Start programs should pay attention to. And I've tried to put some of the bigger topics up on this as an example. The Davis-Bacon Act, which has to do with facilities and construction and remodeling and bidding, all of that process. Head Start and labor unions. We're seeing I don't think we have any in our region, maybe one group in our region, but this is becoming more and more of a topic because Head Start programs in other really pro-union states, this is becoming an issue. And so there's guidance given and information given. Staff qualification for teachers. Everybody is familiar with that. What should be happening in 2013 in regards to nationwide, 50% of our teachers should have a bachelor degree. And again, most of our programs, if they equate that to say in my program, I should have at least 50%. And so, and it should be 100%, but at least, meeting that mark of 50%. And again, information comes out to talk a little bit more about that. Family income guidance, and then I put fatherhood down here, fatherhood involvement. So again, these are just some examples. There's many, many more, and they come out. Information memorandums also come out periodically to help and assist programs. And then there are policy clarification. Again, if you can only imagine that the standards, which have been pretty set in stone for quite some time, and at the same time, Head Start is a movement. It is constantly moving, it's constantly changing, and so there are some times when the standards don't necessarily fit the issue. The standard was so loosely written, and it was written for that purpose of giving a little flexibility. But there needs to be guidance on that. And so policy clarifications, the Office of Head Start created this process a few years back, where if you go on the early learning website, if you had a question, it gave Head Start programs an opportunity to put that question in the form of a little, you could send it into the Office of Head Start through the website, and someone would research that and get back with you, and then post it on the website so that everyone could see that. So it was broken down into various categories. And you'll see the categories down here from grants administration and fiscal management to transportation. And so, again, it was just to help provide some interpretation in regards to some of the regulations. And you can see, and again, I apologize, but you'll get a copy of this, some of the way that it looks on the website. The question is asked, and then it gives an answer to that particular question. And again, they were just made to provide guidance to help not only the Head Start programs, but also the regional office. Because again, I can't tell you, in fact, things have changed in such a degree that in the regional office, we designate every Tuesday for at least an hour and a half. We come together to sit down to look at policy and to look at the process and procedure. How many, and again, it's for our my Head Start colleagues that are in the room. Many times you all will get letters that come out from the Office of Head Start, right? And at the very end of that, the bottom of that letter, it will always say, if you have any other questions, call the regional office. And my colleagues are laughing back there because sometimes you all got that letter before we got interpretation. And so we're going, well, they're telling them to call, they're telling the folk to call us, and we're just reading the letter for the very first time as well. And sometimes we haven't been given all the greatest of clearance as well in regards to what that means. So what happens is we come together every Tuesday to just talk about policies and procedures and issues and concerns that come up, so that we're pretty clear. And at the same time that we give you a consistent answer across the board. We want to make sure that the answer that we give you is consistent, so that if you call one program specialist or you call another program specialist, or even if you call me, instead of sending you to another program specialist, I will have the answer as well. So we just kind of come together to kind of work that process out. And we don't do that in a silo. We will get with our other colleagues. We will get with the Office of Head Start. I have been known to definitely call Washington and get the program content experts in those particular areas to say, okay, you sent this letter out. Now help us understand what it is that we need to know, so that when our Head Start programs call us, or even the general public calls us, we'll be able to give a consistent, good answer that's going to help them to be able to move forward. And again, just just a taste of that. Can a Head Start program require that parents pay a portion of the total cost of any medical or dental treatment provided by the Head Start? And the answer is no, because at no point, Head Start is a public program. It's a federal program. Cannot charge Head Start parents cannot be charged for any type of Head Start service. And again, I got that on my hot topic list because when you look at child care dollars and the wraparound pieces of that, and we do know that there's additional charge that come along with that in Head Start programs. You can do it, but you got to make sure it's clear that they're not paying for Head Start services. They're paying for child care. And sometimes that's been infused. And that's the reason why those of you that have been here, we've bugged you all, and we've created a little storm in regards to the cost allocation. See folk nodding their head. For our state folk, cost allocation, we are clamping down, and we're paying very, very close attention to how child care subsidy dollars are being used. And unfortunately, I will say, and again, nationally, what we're seeing is something that we need to clamp down on. We need to take a closer look at. Office of Head Start is beginning to start taking a look at that as well, because again, we want to make sure that what Head Start should be paying for, Head Start should be paying for, and what child care should be paying for, child care should be paying for. And so that's why we're very concerned, and we're looking very closely at how dollars are being allocated to ensure that happens correctly. The organizational structure for Head Start, just want to make sure I went over this, just so again give you an understanding, an idea. First of all, it's important to know, and again, I'm probably preaching to the choir. Congress makes the laws. Office of Head Start do not make laws. it's the responsibility of Head Start, Office of Head Start, to interpret that and to put that, to interpret the laws and oversight and for funding. And even in that, that's kind of misleading when you look at Office of Head Start, because there are so many other entities. Office of Head Start is under the umbrella of Health and Human Services, the Department of Health and Human Services. And so you have from the Secretary's office to the Office of Administration under the Health and Human Services group. And then there's the Administration, Children and Family, which is, again, a division. And then under that Office of Head Start is one of the departments under the Administration, Children and Families. And so all those different entities are involved in that decision-making process. And again, by the time all of those decisions are made, when it comes down to the regional offices, we are pretty much there for oversight to ensure that the rules are being followed correctly. And then when then there's an outside entity of that, the Office of Management and Budget, OMB. Anything that comes out of the Office of Head Start has to go through their vetting process. There are many, many times when, and I know, again, I'm talking to folk here who do Head Start, you've been frustrated because you know something's supposed to be coming out and they promised you something, but then it was delayed. You may have heard Yvette, the national director, say, this should be coming out a little bit, but at the same time, those dates don't necessarily, it doesn't happen on the dates or the times that they say they're supposed to happen. And that's because it's being held up somewhere. And usually where it's being held up is the Office of Management, Management and Budget, because OMB clears everything that comes out. And they also is the regulatory piece for us. There are times when I would love to do what we make you all do, in a sense, and that is to do community assessments. And self-assessments. I would love, if I would, as RPM, if I could, to be able to do a regional assessment and to send out information to ask for more information. But unfortunately, we can't do that. I can call you up and say, listen, can you give me some stats on homeless children, number of homeless children you're working with? I can call you up and ask you but I just can't send out a little survey asking you to fill out something of that nature, because again, all those kinds of things have to be vetted, has to be worked out through Washington before that happens. Then there's the 12 regional offices. And again, we're one of the 12. Our area is Missouri, Iowa, Nebraska, and Kansas, and we have that responsibility for that. And then the grantees, you all are part of that organizational structure, our grantees, our programs. In our region, we have 86 programs. Did I get that right? 86 programs. The reason why I'm fudging on that is because we've had some changes here just lately. So we have 86 programs that Head Start programs across the 4-state area that we monitor for oversight. And then the local partnerships. Each grantee is responsible for making sure they manage, that they have program governance in place, that they manage their management staff, and for program implementation. And then you have the local partners, the LEAs, the mental health, child care is a part of that, and the vendors that they work with. Here's just some resources so that you understand, again, when we start talking about regulatory processes, Head Start collaboration offices are part of that regulatory piece as well. We heavily rely on them to work with us in each one of the states to help us to understand from a state standpoint what's happening and how that interrelates and should interrelate with Head Start programs. And again, this is one of those examples of that where the collaboration office helps to put situation and programs such as this together. Then we have our training and technical assistant, and I see Ruth Ann and Tammy in the back over there. And so we appreciate what they do getting out to our programs, because they are really the front runners out there in our programs on a regular basis, helping them with circumstances, situations, and different events that are going on, from disability to program management, just making sure that that things are running as smooth as possibly can, and to help also in regards to making sure that high quality, effective programs are being operated throughout our region. And then we have the national centers. We have we have 6 national centers. Each one of them are over a different area: quality teaching and learning, cultural and linguistic, responsiveness, early Head Start, parent, family, and community engagement, management, fiscal operation, and health. So all of those national centers. Am I not talking? You're having trouble hearing me? Can you hear me in the back? Okay. Oh, okay. All right. Okay. Yeah, I'll just do this since I'm not going to move that much. Okay. All right. And again, the national centers, and they assist us as well. They were really designed to help the regional office because we're also in the learning process. We want to be able to know and understand and collect the greatest, the most relevant information that we possibly can, so that when our grantees call us, that we give them the very best of information that we have. So they help us and provide one of the things that I will just point out with the National Center on Quality Teaching and Learning. They have placed a field specialist in our office. And when we make calls to our grantees, especially in relationship to quality teaching and learning and school readiness, we have a person there who is qualified in school readiness, who assist us in helping us to ask the right questions of you all, so that we can gain that knowledge. To be quite honest about that, many of us have come from different backgrounds, different fields, and I'm really happy to say in our regional office, we have a very talented group of individuals, many of which operated Head Start programs. So they understand that. But for those like myself, I never operated a Head Start program. So my learning curve is a little bit lower than some of my other colleagues. So they're able to help us to understand, what does it mean? What does school readiness mean? What should I be asking for? What should I be looking for as a program specialist, as a RPM? How should I assist my grantees in regards to the data aggregation and what they're looking at? Because again, pulling data together, so what? If it's not going to be meaningful in helping to make sure that the design of the program is assisting in enhancing the quality of work from our programs. So again, and then the Early Childhood Learning and Knowledge Center. How many's been on that website? And that, for our child care colleagues, I would encourage you, anything you want to know about Head Start is pretty much on that website. Anything that you want to know is pretty much on that website, especially as it relates to Head Start. And now, again, Betty's going to talk a little bit more about how we even want to enhance that in the future. And then I'm going to take my time. Yep. Just want to quickly just go into some of the hot topics, and I've alluded to some of them already. As it relates to childcare and our partnership, continued partnership with childcare, and I hope that I'm saying this for all of my folk in the room, for all of the Head Start family in the room. We encourage partnerships with childcare in their respective areas, and in probably 99% of our communities where Head Start programs are, they are connected in some degree with a child care facility. But if there are concerns or issues that cause that not to necessarily happen, these are some of the biggies. These are some of the areas where the reasons why that collaboration or partnership is not happening effectively or as well as it could. One of them is, again, cost allocation. I can't tell you how this is probably the most important topic because the community, the public, is paying a lot closer attention to how federal dollars are being spent. And many of them don't fully understand all the different dynamics of child care and Head Start. But they want to know where, and especially for those of you that pay attention to Head Start, one of the big things that always happens in those reports that come out from the Heritage Foundation and some of those other places that are negative about Head Start, and that is they always go back to that $8.1 billion and looking at it as a waste. And we know it's not a waste, but we've got to be able to clearly identify and make sure that everyone knows that their dollars are being used correctly. And so that's where one of the big things come in, and that is, and when it comes to child care, the wraparound services, the wraparound program, and who's paying for what. Because again, Head Start dollars by federal mandate can only be used for Head Start services. And so they were never designed for wraparound services. And so that's why, again, you're able to get the child care subsidy, but you got to make sure that you don't infuse those, don't connect those. And I know it's not all the fault of the grantees, because back in the days when monies were rolling and kind of flowing a little bit easier, regulation and things were kind of loosely knitted to a point where the interpretation of that created some of the stuff that we're seeing nowadays. But we're getting back to what the grants management thing says in regards to how the cost allocation. Monitoring. Again, monitoring goes on a regular basis. Our programs are monitored at least every 3 years. They're also monitored through the regional office, through site visits. When we come out, now we're not going to do it as an intensive. When the monitoring process happens for every 3 years, there's a team, a national team, and it can be anywhere from 5 to 25 people, depending on the size of the organization. And they go out into classrooms. They go out in the different parts of the service areas. They're looking at they're looking at every different component, from program governance to playground, to determine the quality of the service being provided in that area. So it's very important. We've heard where some child care facilities that, they just say it's just a little bit too hard, too difficult. And so as a result of that, partnerships are dissolve as a result of that. But we just need to talk about that and make sure that we work with it a little bit more. Staff qualification is another area, because Head Start don't have a choice in regards to the quality of service, the quality of staff. Then federal regulations versus state licensing. There is movement if we get our reauthorization and the federal standards are revised. There's movement to the point where, as part of that monitoring piece, that if your facilities have already been state licensed, that perhaps we don't have to come in and look at a lot of the state kind of situations, because we'll take that as verification. But there's some movement in that. But again, that's still just talk right now. It hasn't been put into regulation. And then the early Head Start requirements as far as school readiness, parent and family engagement. And then I just put down here DRS, Designation Renewal System. That is another hot topic. A lot of our grantees are nervous, to say the least. Some are just downright scared, to say the least, in regards to what that means, in regards if they go through a monitoring process and there are violations. And usually in that case, and I don't say this to be mean-spirited or whatever, but in many of the cases, it has to do with the partnerships in regards to something that didn't happen, a criminal background check, staff qualification, or something in that. And so some of our Head Start programs feel like it's better just to pull out and just to bring it all back home than to continue to partner. And we're talking with them because we don't want that to happen. But we do have to make sure that our partners, our child care partners, understand what they are under scrutiny for. So with that, real quickly, I think I took up too much of my time. Betty, if you want to come real quick and just talk a little bit about the vision.
Well, I'm going to be very, very quick because Kathy, it needs to get up here. Hi, Kathy. And as Clarence said, we were in D.C. Just a few weeks ago, January 30th, I think, and met with Yvette and with Shannon Russo, our director, and with Linda Smith, our Deputy Assistant Secretary for Early Childhood, and talked about how Head Start and child care can really meaningfully collaborate and really present a picture to the world of what this administration and what the federal government sees as early childhood, not Head Start, not child care, but early childhood. And in that, Yvette and Shannon presented together their vision for children. And it is a joint vision that children belong to strong families that are supported to succeed in both parenting and achieving economic stability, that children and families can access quality early learning services that prepare children for school, and that there is comprehensive support for child development that includes health, early identification of developmental challenges. And the common vision makes sense because we work with the same children. Children in both Head Start and child care are living in poverty or near poverty. Children in Head Start and child care have the same school readiness needs, but what is offered to them depends on whether they walk into the child care office or the Head Start program, and that needs to change. They need to be able to, there needs to be able to be blended, that a child, no matter where they access their child care services or their Head Start services, they're going to get the same quality. For the Office of Child Care, we have our goals that are stated right now are making subsidy child-focused, family-friendly, and fair to providers, ensuring child health and safety, providing pathways to excellence for programs and professionals through various ways, but those are improving quality. And in some states, this is working on improving and promoting their quality rating improvement systems. In some states, it is promoting quality through various other things like developing professional development systems and career lattices. And then also we have a goal for increasing the accountability and program integrity within child care. Our specific strategies to achieve this are very similar to the Head Start strategies that Clarence talked about. We are looking and hopeful that we will have a child care reauthorization this year. And with the emphasis in the administration and the priority given to early childhood within the administration, we're hoping that that can move forward. But if that doesn't happen, we're also looking at some rule changes or additional policy guidances to clarify and to interpret our regulations to emphasize building quality in our programs. We have aligned our child care and development plans that the states submit every 2 years and our technical assistance very tightly, and these align with our high performance goal that the Secretary Sebelius has set forward, which is that we increase the number of states that have a quality rating improvement systems. And for those states who are in a position where that's not going to happen in their state, we are looking at the pieces of quality rating improvement systems and where can that state move forward in that area. And then also improving our data and our transparency on quality. So we are going to be collecting a lot more information on quality and what children are in high quality settings, where those settings are, and the numbers of children that are there. Clarence talked about that this was part of our collaboration in going to this meeting, but Clarence and I have made a pact, and the reason I came today, Clarence and I have made a pact that we're going to try to present our common vision together more often. So in meetings like this, or in meetings that we have on the child care side, Clarence and I are going to try to at least jointly give federal updates and be a joint face for early childhood in one way. And we're looking at a lot of other things. One of the suggestions that we made when we were in DC is that Clarence referenced the eClick system, the early learning system that you can access through Head Start. But what we want to do is look at the child care resource systems and our websites, the eClick system, and make those interrelated so that no matter where you enter, if you're a child care provider or a Head Start program, no matter where you enter, you can move through those and get to information that can help you in your program. So we're really hoping that we can get that moving this year, and a lot of other ways that we can more meaningfully collaborate. And so I think it's Kathy.